Welcome to Global Yoga Flow. We're working with rehabilitation of the knee post-surgery. The scar tissue in the knee joint is going to build up after surgery. It's the body's intelligence protecting the area that's been worked on. But our responsibility is for releasing that scar tissue so it doesn't bind the joint and the mobility of the joint. The knee is a hinge joint, and its job is to flex the knee deeply and extend the knee fully so we have freedom of movement. In this exercise, we're working on flexion. Often, right after surgery, just getting the knee to 90 degrees like it is here can be a challenge. But we want more than that. We want to get to at least 120 degrees, something like this position. And hopefully we'll eventually be able to get the heel very close to the hip, full flexion. So sitting on a stool or a chair and on a tile, wood, or vinyl floor that's slidey, have your foot on a towel. And you're just going to mop the floor. So just this motion back and forth, making it nice and smooth and steady. Keep the foot pressing into the sliding surface, into the towel evenly. So the foot's not lazy here. It's pushing evenly into the towel like you're trying to scrub out a spot. Yeah. And just this mobility, and you'll feel the joint will tire quickly. Yeah. So you wait until you feel, wow, okay, I'm getting some work in that joint. And then pull it in as much as you can. Use the other foot to pull it in a little more and breathe. Just 5 deep full breaths, holding it on that really edgy angle. You can even give it a little massage. Just try to soothe the nervous system with deep breath while you're holding that new angle, deeper level of freedom, and then release it. Rest, let everything soften, and then begin again, scrubbing out the spot on the floor. Waiting to feel the energy build, the lactic acid build, a little bit of exhaustion come in, yeah, and just heating up and lubricating the joint, and then you'll draw it in. You can use your foot, draw it in a little bit more, and then you're breathing. You'll do 5 deep full breaths. Soften, let it rest. And then do a 3rd round. So you'll slide back and forth until you'll feel the exhaustion. You'll feel when it's just too much. And then stop, pull in. Use your other foot to pull in more, a little bit more. 5 deep full breaths. Exhaling through the mouth is good. And then release and let the joint rest. And do that 3 times a day, 3 to 5 rounds of doing the floor scrub, hold the flexion, deepen it, breathe deeply, a couple rounds of resting, and start again. Build that freedom back into the joint. Thanks for watching.